Hello everyone, welcome again to my channel. This is Dr. Zina speaking. Today we'll be talking about the difference between mucocele and ranula. But before we continue, make sure to hit the subscribe button down below for more videos. Now the mucocele, it is seen in the lower lip and it is bluish in color, not like the hemangioma, which is also can be seen in the lower lip and it is red in color. So this is the clinical presentation for the mucocele seen in the lower lip, and it is painful. Now, what is the cause behind the mucocele? First of all, the mucocele is related to the salivary glands, the minor salivary glands. So if there is a blockage of the salivary gland, like we have silence, which is a stone within the salivary gland, it can cause mucocele. Or if there is a trauma to the salivary glands, also it can lead to mucocele as well, because trauma can result in blocked canal or gland duct, which will result in turn to mucocele. Now, what is the treatment in this case? We cannot do incision and drainage, because if you did incision and drainage, it will return back again. So the only option we have is surgical excision of the entire ulceration in order to not recur back again. Whereas in the other hand, ranula is a mucocele, but it is seen in the floor of the mouth, not like that mucocele. That mucocele, it is seen in the lower lip, whereas the ranula, it is seen in the floor of the mouth. So the difference, how you can differentiate, is based on the location. So as you can see, we have a large vesicle that can be seen in the floor of the mouth. It is also similar to mucocele, that it is bluish in color. Now, in some cases, we might have a small ranula. If it is a small, it may disappear by itself, but if it is large, then it requires treatment. What does ranula mean? Ranula comes from a Latin word, means little frog. Why they called it as ranula? Because it looks similar to the frog's belly, as you can see in the picture. So this is how you can remember. Remember, ranula means frog, and this frog's belly is located because it is large. It cannot be seen in the floor in the lower lip. It will be seen in the floor of the mouth. This is how you can remember later in the future. What is the cause behind it? Also similar to the mucocele, if the sublingual gland is diseased or injured, then a cyst will form in the floor of the mouth. So also similar to the previous one, if there is any blockage of the salivary gland, it will lead to this condition. So the number one cause is trauma. Trauma leading to blockage in the salivary glands. Blockage in the salivary glands will lead to either ranula or the mucocele, depending on the location of the trauma. Now, as I said previously, if we have a small ranula, it will heal by itself without treatment. It just takes weeks and then it will disappear. But if we have a large ranula, just like the picture you saw previously, we need to do a surgical incision and drainage. And in sometimes we can do surgical excision, which is the complete removal of the large vesicle so that it will not recur back again. But also, in some cases, we can do surgical incision and drainage. Now, what will happen if left untreated? Pain and swelling will be seen, and of course, whenever you eat, you will experience pain because obviously it's under the tongue, and when you move your tongue, it will press against this vesicle and it will cause pain. So we need to do treatment for such cases if it is large, but if it is small, it will disappear by itself.